This gentleman I'm working with has something called fasciculations, which are involuntary muscle twitches in the legs, presumably from a lower motor neuron injury. Now, he's had so many procedures, about 4 epidurals, PRP injections, maybe around 8 cortisone injections, Botox in his piriformis muscles, and yet they still twitch. As you can see here, they're still jumping. He even went as far as to get a permanent spinal cord stimulator implanted in him, which didn't do a thing. Still twitching. Finally, they went ahead and did an RFA, radio frequency ablation procedure, where they burn the nerves from the lower back. And yet he still has some twitching. So we've been working on this pretty aggressively, and what we've hypothesized is he has a neuropraxia injury to the peripheral nerves. More importantly, he has something we call double crush syndrome. We suspect that the first crush is somewhere in the lumbar spine, and the second crush is in or around the ischial tuberosity and piriformis. What we do know is that it is a lower motor neuron injury, not central or upper, because the brain and spinal cord seem to be fine. Just lower motor neuron, and that's why we see the fasciculations and not the clonus. But we start working really slow with greater pressure over the greater trochanter, and then working into external rotation. He usually starts at about 10 degrees, and then over the course of about 20 or 30 minutes, we get to about 50, 60, 70, and then even to 90 degrees, at which point his pain goes from a 9 to about a 2. So hip mobility is improving, but we've been also predominantly focusing on nerve glides. So slowly stretching the nervous tissue in the posterior chain to reduce any spasms. Some soft tissue has worked as well, but we often been putting him in this side-lying facet gapping nerve stretch position, which seems to alleviate his nerve tension as well. We do these around 20 repetitions or so. I also have him in side bending to decompress the facet joints where we think the first crush is coming from, and then moving his spine back and forth to help stretch the nerves. The home exercise that I mostly have him doing is individualized nerve stretching techniques. Now, when we first started, he couldn't get his foot more than 90 degrees, and he's making progress. But after seeing about 25 doctors and them doing every test in the world, from EMGs and NCVs to MRIs, CTs, X-rays, and Dopplers, they can't figure anything out. So we're doing our best to make progress. Reach out with any questions.